India bears one of the heaviest burdens of cardiovascular disease or CVD globally, with the death rate from CVD being higher than the rest of the world. Shockingly, CVD strikes Indians nearly a decade earlier than Europeans, often during their prime years. Presently, CVDs account for 27% of total deaths in India, with a 12.5% surge in heart attacks in 2022 alone. Alarmingly, 50% of all heart attacks in India occur in men under the age of 50, with 25% striking those under the age of 40. Women are equally vulnerable, with 25% succumbing to cardiac diseases, a significant portion of which even goes undetected. Common risk factors like diabetes, alcohol, smoking, inactive lifestyle, stress, and uncontrolled blood pressure significantly contribute to the prevalence of cardiac diseases. Additionally, sudden cardiac death poses a pressing concern, claiming the lives of seemingly healthy individuals, including younger adults, celebrities, and athletes during routine activities. Addressing this crisis requires urgent action. What steps must we take to foster healthier hearts? Today, we are privileged to have two of the best experts in the field, Dr. Ajit Menon and Dr. Ashish, Contractor, joining us to delve into cardiac care, address concerns, and guide us towards a healthier future. Welcome to the show.
As we're experiencing great prosperity, economic prosperity, also we've tended to become more sedentary.
The first hour after a heart attack is the one that is the most important.
We also tend to store a lot of fat around our waistline, so we sometimes call it the thin fat Indian.
A normal blood pressure is typically 120/80.
Doc, I used to smoke 10 cigarettes a day. Now is it okay if I smoke 5? I say it's like asking me, should I jump from the 10th floor of a building or the 5th floor, right?
The other simplest thing that you can do if in a suspected heart attack is get a dispirin tablet, dissolve it in water, and make the person drink that water.
Dr. Menon, I'm going to start with you with a basic question. Why does India have such a high burden of cardiac disease?
I think Indians in general have always had a very high incidence of heart disease. Probably this has also to do with the lifestyle that we lead. It also has to do, sir, with certain genetic issues that are prevalent amongst Indians. And also, to a certain extent, to a surge in various risk factors that we see. Now, if you're looking at the genetic part of it, as Indians, we have a certain issue with our cholesterol levels, where we genetically have a low level of the good cholesterol, which is the HDL cholesterol, and a higher level of the triglycerides, which is another form of fat. And typically the LDL cholesterol, which is the bad cholesterol values, are also on the higher side. So this is a genetic trait which is specific to Indians and to certain South Asian communities. That puts us at a much higher risk of developing coronary disease. Having said that, I think lifestyle also has to do a lot with the sudden surge of heart diseases today, where we see a lot of pressure on youngsters. The living styles have changed. Exercise is not to the extent that we expect people to do. And if you look at the numbers of people who really exercise, it's a very small fraction of the entire population. So it's multifactorial. I think, I'm sure stress and pollution today has a major role to play in the higher incidence of heart disease.
Okay, Dr. Contractor, how does the Indian lifestyle, like Dr. Menon mentioned, how does that contribute to the prevalence of heart disease, and how much of it is genetics?
So, Ekta, over the last few decades, as we're experiencing great prosperity, economic prosperity, also we've tended to become more sedentary. Food habits have changed. There's a lot more processed food that we're all eating. We may call it junk food, we may call it fast food. So those habits have changed from our forefathers, and all of those contribute to the underlying genetic predisposition which Dr. Menon mentioned. We also tend to store a lot of fat around our waistline, so we sometimes call it the thin fat Indian, where overall the person's not heavy, but they store fat around the waistline. So all of these tend to create an atmosphere where we have higher risk of diabetes, heart disease, and all of it tends to happen at a younger age, like you mentioned, a decade earlier than the Western population.
Well, Dr. Menon, there is one misconception in India that when people think that they have a heart problem, it's generally a heart attack. But there is a difference between, say, a cardiac arrest as well as a heart attack. Can you tell us the difference?
Well, a heart attack is actually when the blood supply to the heart muscle stops. Now, the heart is like any other organ. It has blood inside, but it cannot survive with that. There are arteries on the surface of the heart muscle which actually supply blood to the heart muscle per se. So when you have blockages that come inside those arteries, it's basically because of cholesterol deposition. The blood supply to a specific area gets reduced, and because of some certain specific reasons, during an acute episode, the blood supply completely stops, and that gives rise to a heart attack. It's akin to the water supply to your house getting cut off completely, right? So that's one part of it. So a heart attack is where the muscle gets damaged. It doesn't stop the heart. The heart continues to function, but you get chest pain, you get breathless, you have changes in the ECG which suggest a heart attack, and you go to the hospital and you get treated. The other aspect of it is a cardiac arrest. Cardiac arrest is a stoppage of the electrical impulses in the heart. A heart functions because of certain electrical impulses which are generated by the upper chamber and conducted to the lower chamber, and each impulse gives a pulse. So when you have a stoppage of the electrical impulse, that's when the heart stops. And when the heart stops completely, that's called a cardiac arrest. So these two, though they sound similar, they're completely different. A heart attack is basically a death of a muscle. A cardiac arrest is basically stoppage of the electrical impulses. Now, a heart attack can give rise to a cardiac arrest, but a cardiac arrest is not necessarily because of a heart attack.
So which one is probably treatable more easily?
A heart attack definitely is more treatable. Because then you get time to go to the hospital. There are certain procedures that can be done to treat a heart attack, and the muscle can be salvaged. The most important part is if you have symptoms of a heart attack, get medical help as soon as possible, because there's something called as the golden hour. The first hour after a heart attack is the one that is the most important. If you get treated in that 1 hour, your heart muscle can be salvaged. One thing that I need to stress upon is that heart muscle is one of the muscles in the body which, once it is injured, it never recovers. So time is of essence when treating a heart attack. A cardiac arrest survival depends upon what happens and who witnesses the heart attack. Now, if it is witnessed by someone and someone starts a CPR on the spot, the chances of survival are much higher than if you just wait and look around and wait for an ambulance to come. So there are certain CPR modules which are available in the city today. There are the AED machines, which are defibrillator machines placed in certain places, which help a common man to treat a cardiac arrest on the road if it is witnessed.
And how does one diagnose it? What are the symptoms? When should one see a doctor?
I think, again, coming to these two different conditions, if you have chest pain on exertion, if you get jaw pain on exertion, you have a typical constriction in the center of the chest or in the throat on walking, and that radiates to either the jaw or to both the hands or on one side. Or if you have any breathlessness, which is undue, which you didn't have earlier, and you're getting breathless on walking. Or another odd symptom is you get up in the middle of the night feeling breathless. You have to sit up. You feel better on sitting up. The moment you lie down back again, you start feeling breathless again. Now, these are typically cardiac symptoms. If you get any of these symptoms, get examined, visit your doctor, get your routine checkups done, and a physician should be able to tell you whether these symptoms are cardiac or non-cardiac.
Okay, but uncontrolled blood pressure, I think that's one of the key problems. 1 in 4 people suffer from uncontrolled blood pressure in India. How does one resolve it? What are the key symptoms to watch out for? What are the key readings? How often should one probably take their blood pressure? What would you recommend to somebody?
Well, the only issue that we have with recording blood pressures at home is that we have to use electronic monitors, and there's a certain way of recording the blood pressure. Now, what symptoms do people have when they develop a blood pressure? A lot of patients do not have any symptoms whatsoever. It's only when you go to a doctor for a routine examination and you check the blood pressures that you realize that the blood pressures are on the higher side. Some of the symptoms could be, again, breathlessness, frequent headaches, waking up with a headache in the early in the morning, or late evening headaches as you finish work, because typically the blood pressure tends to rise at 2 times. One is early in the morning because of the circadian rhythm of certain hormones, and one is in the evening after your stress levels are pretty high, your work is over. That's when the blood pressure starts to rise. In terms of how do we come to check it, the best, if you have a family history of blood pressure, it's always better to keep a check on your pressures once in a while, at least once in a couple of months. Keep a random check on your blood pressures. It will tell you whether the blood pressures are normal or not. Now, that brings us to the question, what is a normal blood pressure? A normal blood pressure is typically 120 over 80. There was a perception that beyond the age of 60, you can still have slightly higher blood pressures, but that conception is no longer valid. And I think we need to still keep our blood pressure around 120 to 130 on the top and below 80 on the bottom.
What about risk factors such as alcohol, smoking, and stress? Stress, I mean that, it probably results in other factors or habits which could result in possible risk factors increasing. So alcohol as well as smoking and stress.
Okay, so let's address all three sort of separately. The first one is easy, smoking. So when we talk about lifestyle modification, we always talk about being moderate. But this is one area where it needs to be zero. So smoking, tobacco consumption, including vaping, which especially the youngsters are into these days.
So vaping is a big risk.
Absolutely, and that needs to be zero. There is no moderation. Sometimes patients ask, Doc, I used to smoke 10 cigarettes a day. Now is it okay if I smoke 5? I say it's like asking me, should I jump from the 10th floor of a building or the 5th floor, right? So the answer is no. Smoking has got to be zero. Then we come to alcohol. Now, this is where it gets interesting because kind of for a long, long time, even the Heart Association recommendations were that moderate alcohol is not bad for your health, red wine is good for your health. But keep in mind that a lot of these studies were also sponsored by red wine growing countries. And today, the research has shown is, ironically, that even a little bit of alcohol is not necessarily good for you. So I have a simple line for my patients. I will never encourage anyone to start drinking, right, for heart health. If they are drinking and they're doing so in moderation, and we need to define moderation, then I would allow them, but certainly not to start drinking. Your last point was stress. Now, stress and heart disease has a sort of a bi-directional relationship. As you said, one is the indirect effect of stress. Because someone is stressed, they may say, oh, I need to smoke, I need to have a drink, I don't have time to exercise, right? So that's an indirect. But we know that there are direct effects of stress on the heart due to the hormones kind of release. So we know that stress can lead to heart disease, stress, anxiety, depression. And heart disease itself can also lead to things like anxiety, depression, and stress. The only problem with stress is we cannot measure it. Like he said, we can tell you your pressure should be 120/80. We can say your fasting sugar should be below 100. But there's no number to stress, right? You're a financial channel. So if a white-collar worker suddenly sees the Sensex drop, his stress level is going to go through the roof. But the blue-collar worker, it's not going to affect him. But if the blue-collar worker loses a 100-rupee note on the way to work, it might affect him much more, than his boss might. So stress we cannot measure, but we definitely know that it's not good for your overall health and heart health and needs to be kept under control.
Managing stress is a whole different conversation.
But if I may add here,
yes.
Stress, I agree with what Dr. Ashish said, that stress is a non-quantifiable risk factor. It's not the stress that matters. It's the reaction to stress that matters. There are certain people who can take stress and react to it very differently. There are certain people who react to it in an absolutely negative manner also. So that reaction to stress is what releases the hormones, and that's where it has a direct effect on the heart and other organs.
Okay, well, that's a very important point to note, that it is your reaction to stress. And yes, stress is not quantifiable, but don't pick up that cigarette, don't smoke that vape, or don't pick up that drink in a reaction to it. We'll take a break, be back with more questions. Welcome back. You're still tuned into Health Matters on the Medicine Box on CNBC-TV18. Well, Dr. Menon, I'm going to come to you about women's symptoms because it's very vague when it comes to heart disease, cardiac disease, and many people think that it's a man's disease and not women. What would you recommend to women?
I think women in the premenopausal stage are usually a little less prone to develop heart diseases. But once they reach menopause or the immediate premenopausal stage, as the estrogen levels go down, they have an equal risk, if not greater risk than men, to develop heart diseases. Their symptoms are often discounted because the male, and traditionally because what happens is the males take predominance over the ladies in Indian society. A lot of time, ladies' symptoms are not taken cognizance of, and they remain untreated to a large extent. The symptoms usually are the same. They are at a much higher risk if they have diabetes. They are at a much higher risk if they are smokers. And they are at a much higher risk if they have a family history. And typically what we also have seen, if the mother, the lady of the family has had heart diseases, the chances of the lady transmitting the disease to the children are much higher. And that is something which we have seen in practice, though we don't have any data on it. And the symptoms are also a little vague because they typically have symptoms more at rest, not so much on exertion. Very often because of obesity and inactivity, their breathlessness is not taken cognizance of. And a lot of the symptoms get brushed under the carpet. But beyond the menopausal group, they are as prone to heart disease or probably more than an average Indian male.
Okay. Well, talking about that, the other set which stands out when it comes to cardiac issues is the younger athletes running the marathon, somebody working out in the gym who does it routinely, a celebrity or a person who's at a concert collapses and dies of a heart attack. Why is that? They're doing routine activities. Why are they just collapsing?
So very quickly, in general, when someone is below 35, usually the cause of death are things like cardiomyopathy, etc., which Dr. Menon had mentioned. It's not really heart attack, as a general rule of thumb. And above 35, it's most commonly a heart attack. Now, please remember that whoever dies suddenly, it's not that they were healthy the day before the exercise, right? The blockage is like, think of it as a volcano. It's sitting out there and one day it erupts. So that sudden bout of exertion, excitement causes the volcano to erupt. It's the final trigger, so to speak. So there was heart disease brewing, but that exertion did not cause a heart attack. It was just the final trigger that led to it.
Okay. There are many people who want to run marathons now, even in their 40s. What are the screening tests that you would recommend to them before they start that?
So check all your risk factors, as we've been talking all along in the show. Go and meet your doctor, meet a cardiologist, meet a sports doctor who understands what you're about to embark on, and he or she will suggest a slew of tests, at least your basic blood test, a basic stress test, 2D echo. These are some of the common tests, but talk to your doctor of what's appropriate for you.
A CT of the heart, that's what's been recommended now for some athletes?
So that becomes an interesting, that's a bit of an area where your doctor needs to decide. I don't think each and every person needs to do a CT angio. Who needs to do it depends on your history, family history, symptoms, risk factors, etc. So you really need to talk to your doctor before doing that.
Okay. Dr. Menon, what are the basic tests that you would recommend to both men and women when it comes to cardiac care, and by what age and the frequency as well?
See, once if you have a strong family history of heart disease, then I would say that by the time you're 30, start getting your routine bloods done. Once you're about, like Ashish said, about in the range of 35 or so, you can do a stress test, which is typically a treadmill test, which is the simplest of all the tests that you can do, to look at your the heart response to exercise, and that gives you a general idea of what your heart health is. You can check your cholesterol values. You can check your, there are certain tests for lipoprotein A. There are certain tests for homocysteine. There are certain tests for apolipoproteins. These are all risk factors for developing coronary disease in the future. So if you start checking them by the time they're 35 or 40, you probably will have some idea of where you're going in terms of the probability of developing heart disease.
Okay. What is the linkage of COVID-19 to heart disease?
Well, COVID-19 was an inflammatory disease. The process of atherosclerosis that develops blockages is also an inflammatory disease. So we still don't know what COVID has done. I don't think any one of us is very clear about how it did affect the entire body. But we did see a much higher incidence of clot formation Heart attacks with clot formation, younger heart attacks, younger people getting cardiac this thing. I think it's probably a part of the entire inflammatory panel that was there with COVID. And I think it's still left behind a certain residue. And probably over the next few years, we'll know what actually COVID has done to our entire population.
All right, well, we have a couple of queries coming from our viewers, so I'm just going to shoot them at you all. Dr. Contractor, I'm going to start with you. For healthy individuals, what is the exercise which is recommended as well as diet?
Start with walking. Just be more active. Start with walking. Once you start walking, then let's look at doing something more. In terms of diet, keep your quantity of food under control such that your weight is okay, and it should be fine. Otherwise, we can go into great detail, which we won't right now.
What about supplements? What would you recommend in terms of supplements for heart health?
I don't think routine supplementation is required. If on an individual level you have certain things like Dr. Menon mentioned, like homocysteine, for example, then we could recommend some B supplements. But there isn't a across-the-board heart health supplement which I would recommend.
Okay. 10,000 steps, is it necessary?
It's necessary to get more active. So find out where you are today and let's just try and get better. If you're at 2, try for 4 instead of 10,
But
right?
do you need to do 10,000?
You need to do, research has shown somewhere between 7 and 9 is the sweet spot.
Okay. Gadgets, do you think that's a great way to track your heart health, or do you think that it's anxiety inducing?
So I use the gadget. People who like data and will take good feedback from it, by all means do it. But everyone doesn't have to do it.
Don't get obsessed with it.
Okay, but is it important to probably track your heart rate as well as your steps constantly and your heart health with gadgets? Would you recommend that?
If you ask me, I wouldn't recommend it in a general basis because it increases the anxiety of people. It's good to track your heart rate because there are certain studies that show that slower the heart rate, your longevity is longer. It's good to see the amount of steps that you do, but at the same time, if you're going to walk 5,000 steps at a leisurely pace, it doesn't make sense. If you need to do those steps, you need to do it at a faster pace and spend some energy doing it.
Okay. Now, we spoke about the signs and symptoms of heart attack in men and women, but what if somebody else is getting a heart attack? What would you recommend the person does?
I think typically if you're sure, I mean, the basic problem is diagnosis of a heart attack. Suppose, I mean, if you give the wrong medicine at the wrong time, it can worsen the patient's condition. The best thing to do if you have a person having severe chest pain, sweating, is to take him to the nearest doctor, the nearest hospital, and administer him the treatment. If you cannot, then at least just make sure that you clear the air around him, make him lie down comfortably, and get help wherever possible. There is a tablet called Sorbitrate, which can be given under the tongue in case of an acute heart attack. But those tablets can be deleterious. If the blood pressure is on the lower side, it can drop the blood pressures even more. The other simplest thing that you can do if in a suspected heart attack is get a Disprin tablet, dissolve it in water, and make the person drink that water. Okay. So that aspirin can help you till that time being, till the patient reaches the hospital.
Okay, all right. So those are the SOS medicines, and that was basically my next question. Just before we wrap up, an immediate lifestyle change for good heart health, which you would recommend. Dr. Menon first.
Good sleep, exercise, and moderation in diet.
Dr. Contractor.
So I'll just call it A, B, C, D, E. A is activity, B is blood pressure, C is cholesterol, D is diet, diabetes, and do not smoke, and E is exercise.
All right, Dr. Menon as well as Dr. Contractor, it's been a pleasure. Thank you very much for joining in and speaking to CNBC-TV18 about cardiac care. Thank you.
Thank you so much. Thank you. Thank you for having us over.